Thank you to all of our witnesses for coming here today. Mr. Joyner, you are the CEO of CVS Health, correct?
Correct.
And I actually don't know how many Americans know this, but CVS Health owns Aetna, the health insurance company, correct?
Correct.
And CVS, which owns Aetna, also owns Oak Street Health medical clinics, correct?
Yes, it does.
And in addition to that, they own, of course, CVS pharmacies, and CVS Health also owns CVS Caremark, the pharmacy benefit manager, which helps negotiate some of these rebates and prescription prices, correct?
That's correct.
And CVS Caremark processes nearly 30% of all prescriptions in a given year. And so, in other words, CVS Caremark helps determine the prices that patients pay for a third of all prescriptions in the U.S. In fact, I was following one of CVS's CVS's investor calls where they really laid out quite clearly what this means if you are a patient. This is what's known as a captive strategy. And CVS, in the investor call, used the example themselves of a patient known as Kate. Kate has an Aetna health insurance plan right here, and which is owned by CVS Health. She then goes to a CVS pharmacy. She's connected to an Oak Street Health medical clinic. She sees a doctor at Oak Street Health who prescribes her medication. And then she goes to fill that prescription at a CVS pharmacy. So the price Kate pays for that medication is dictated by Aetna, CVS Caremark, and they also own the drug manufacturer Cordavis. Mr. Joyner, this is quite a bit of market concentration. Wouldn't you agree?
No, I wouldn't agree that it's market concentration. I would suggest it's a model that works really well for the consumer.
Yeah, I think it works very well for CVS. I think, in fact, you all said on the call that you all call it a fully engaged member. It's great marketing there. Fully engaged member unlocks sizable value for payers and CVS Health. So the health insurance gets a cut, the pharmacy benefit manager gets a cut, the drug manufacturer gets a cut, and the patient gets screwed. I think the Federal Trade Commission has also found that healthcare conglomerates like CVS Health charge more for medications filled at their pharmacies. We're talking about 1,000% markups on medications for cancer and HIV. And, I think this is actually an interesting point of common ground that I may have with some of our Republican colleagues here in this hearing. Because whether you're a blue-blooded capitalist or a card-carrying democratic socialist, I think corporate monopolies are a problem. And this vertical integration is destroying people's ability to access care.